I'm privileged to welcome you all into the Health Talk series organized by Student Council of Sadabai Raisuni Women's College, supported by SGR Knowledge Foundation and powered by Raisuni Group of Institutions. The sinuses are air-filled spaces in the skull. They are located behind the forehead, nasal bones, cheeks, and eyes. Healthy sinuses contains no bacteria or other germs. Most of the time, mucus is able to drain out and air is able to flow through the sinuses. Sinusitis is an inflammation of the sinuses that can cause them to get blocked and filled with fluid. It is usually caused by cold or allergies. So, to know more about it, we have Dr. Chabbra Handa on topic nose and sinuses. I welcome you, ma'am, in our Health Talk sessions. Dr. Chabbra Handa is presently working as Associate Director in the Department of ENT at Medanta, the Medicity, Gurgaon. She is a graduate of Amritsar Medical College and postgraduate from PGI NER, Chandigarh, with more than 30 years of experience in the field of ENT and head and neck surgery. She has earlier worked as consultant at AIIMS. Her main interest at AIIMS, Moorchand and Holy Family Hospital. Her main interest is in rhinology, managing rhinosinusitis, especially fungal sinusitis, rhinoplasty, along with neurotology, micro-ear surgery, and hearing reconstruction. She has special interest in pediatric otorhinolaryngology. She has more than 40 publications in various national and international journals to her credit. Ma'am, I must say, you really have interesting profile, and I'm sure our audience is very keen and are very keen to know more about you. So, ma'am, without any further ado, I would like to hand over the session to you.
Thank you, Mariya. I think you people are doing a great job by spreading this health issues, health awareness amongst the students. And today I'll be talking about sinusitis, which you already seem to know a lot. So I'll be sharing my slides.
Yes, ma'am.
So as you know, this is a very common problem. Sinusitis, everybody in life must have suffered from common cold, cough, flu. Patients don't understand the seriousness of the issue. Either they overdo, that is, they'll take a small problem very seriously, or they will ignore big problems. So here today I am trying to tell you people how to manage sinusitis and what are the things that you should know.
Yes, ma'am.
So I'll be covering under different heads goes to this infection, and how do we diagnose as ENT surgeons, and how we diagnose it, and how do we manage, and what are the possible complications that we see in these cases. So as you have already mentioned, that sinuses are nothing but air-filled cavities in our skull. So we have different pairs of sinuses. We have just in the forehead, frontal sinus, in the cheekbones, between the eyes and back of the nose. The different sinuses, they are nothing but air-filled cavities which are connected to the nose. All these sinuses, they drain into the nose. See, all this lining of the respiratory tract is lined by a mucosa. And this mucosa keeps producing mucus, which is there to humidify the air that we breathe in. It provides a humidifier. And it also has small cilia, just like we do daily cleaning of our home with brooms. So our body has inbuilt cilia, which keep beating backwards, and they clear the sinuses. Whatever this mucus is produced, it is cleared by the cilia and pushed back towards the throat, and then we swallow it.
Yes,
So
ma'am.
these sinuses, they have some purpose. Like they, whenever we speak, they provide resonance to our sound. You must have realized that when we get cold, our voice changes. So you have a nasal kind of a voice. Some singers also, they use this thing. They sing like using the nasal twang. And plus, they act as a cushion, like when we get trauma, so they provide us an extra cushioning effect so that our brain, which is there in the skull, doesn't get injured. Plus, they make the skull light. So otherwise, our skull, if had it been all bone, our skull would have been very, very heavy to carry on our shoulders. And the mucosa lining is there in the sinuses, which is in continuity with the nose mucosa. So coming to the sinusitis. What is sinusitis? Itis means inflammation. Anywhere in the body, if there's itis, inflammation, we use word itis. Like arthritis is the inflammation of the bone. Appendicitis is the inflammation of the appendix. Mucositis, inflammation of the mucosa. So, sinusitis is the inflammation of the nasal mucosa, nasal and sinus mucosa. Since
Okay.
these are in continuity, so we always say rhinosinusitis. That is, rhino means related to the nose and sinus means related to the sinuses. So rhinosinusitis. Now, how it
Okay.
starts? If you see this picture, this is showing one sinus here. So this sinus, all these sinuses, they drain into the nasal cavity. This is the nasal cavity. So if this is the opening. So if this opening gets blocked because of any reason, could be viral infection, allergies, or there's a mucus plug sitting here, which blocks this drainage path. The mucus which is produced in the by the mucosa, it will get stagnated here. It will not be able to drain out. Once the mucus collects, so then this is a good culture for bacteria to grow. And then once bacteria grow, it further adds on to the inflammation that happens. The mucosa further gets inflamed and edemated. So it's a vicious circle. If you see this cycle, so obstruction, then the secretions stagnate, the cilia that beat, so they also get damaged once there's inflammation. So they are no longer able to clear our sinuses of the mucus that is generated. So a vicious circle starts, inflammation, bacterial growth, and then further it keeps perpetuating. So then what happens once we get sinus inflammation? When the sinus gets inflamed, we'll feel the blockage in the nose. It may not be proper blockage in the sense that not all cases will have total blockage. Some patients may continue to breathe, but they'll feel stuffiness or heaviness in the nose. And they will have, because of the inflammation, they'll feel facial fullness, the pressure on the face, cheekbones. They'll feel a heaviness in the face, or maybe the sinus involved over that, they may get discomfort on that. And the some discharge, the if it is bacterial, then the discharge may be dirty, greenish looking. If it is viral, then it may be just simple mucoid white looking. So from the type of discharge also we get to know what kind of infection it is. Uh, since the mucosa, olfactory mucosa, which senses the smell, it is there towards the roof of the nasal cavity. So that also gets inflamed, so we are not able to smell properly. You must have realized when we get flu, we don't like to eat because the taste also is related to the smell. So we don't like to eat, appetite goes down. And even in COVID also, many patients, they got a loss of smell. So this is a similar thing that happens because of the swelling there. We are no longer able to smell properly. And in acute cases, when the problem is very severe or acute, patients may get fever also. So these are some of the major symptoms. Two of these symptoms have to be there, and one of them should be either blockage or nasal discharge. If you have just the blockage and no other symptom, then it may not be sinusitis. It could be something else. Or if you have
Okay.
just nasal discharge, no other symptom, then it may be something else. So don't worry if you have only one symptom. But you need to see what other things you have. Like some patients may get minor symptoms like headache, pain. Some patients even go to dentist thinking that it is a dental pain, but it turns out to be a sinus pain, or other way around.
Okay.
Patients may think it's a sinusitis, but dental pain may be the cause. And this pain may get referred to the ear. So Patients sometimes visit us that they think that it's a ear pain, but it turns out to be sinus which is giving them problem. And if there is dirty, purulent discharge, then they may have bad breath from their own nose or mouth. And once the discharge trickles back into the throat, so they start coughing because of the irritation of the throat. And generally, they feel weak, low. When we have cold, we don't feel like, though we are not very sick, but we feel that we don't feel too well to do
Yes.
our job. So,
Yes.
uh, then we divide the sinusitis depending on the duration. For you, I think it's better to take it this way, depending on the duration. We do it other way also. Rhinologists, they like to do depending on the pathology that is there. But to keep it simple, I will say that if you have, sorry, if you have any symptom for less than 4 weeks, so we call it acute. And if the problem has been continuing for more than 12 weeks, we call it chronic. Now you have chronic sinusitis. Anything in between will be subacute sinusitis. But some patients, they keep getting cold off and on. Every 2, 3 months, they say that they get cold and then they're all right. So this is recurrent. Recurrent means it keeps happening. That means there may be something which remains behind, which immediately flares up as soon as the body immunity goes down. So this is called recurrent. And some may have chronic symptoms. Like chronic symptoms are not as bad as acute, but in between they may get acute exacerbations that they had some vague pain, some postnasal drip, but in between it becomes really, it flares up and patients that get fever, headache, and runny nose, which increases in quantity. So we have to divide because the treatment depends on this, like what chronicity, what is the duration. Apart from that, we also see the pathology, which we have other means to assess. But for today's talk, I'll just keep it for general knowledge, how you should approach it and what is important for you people. So this is a graph which shows how common cold progresses. You must have realized that when you get cold, initial few days you get slight itchiness in the throat. It basically starts from some mild discomfort in the throat, and some people think that it is tonsil infection, while it is not. And after a few days, you start getting congestion in the nose, runny nose, may get fever also, and then there's a postnasal drip which leads to irritation in the throat, and then cough lingers on. Most of the cases, the flu cases, they are all right in 5, 7 days or maybe 10 days at the most. So whenever we see that the infection has become better in 7 to 10 days, that we presume it was a viral illness. We don't test in all cases, but clinical history and the type of discharge and the duration, it all helps us to know that this may be a viral. So we just in this, I'll come to the management later on. But right now, I'm just focusing on how, like for you people, if you have symptoms for 7 to 10 days, don't panic. It usually, I would say 80% of the cases, they get better without any medication or maybe a symptomatic treatment for that reason.
Okay.
Uh,
Okay.
but if you see this, nasal obstruction is the last thing to recover. And then cough further lingers on. At the most 15 days, by 14, 15 days, you should be fine. If you don't have fever, if the headache subsides, then slowly other things will also fall in place. But there are some cases which after they were, see if this, you see this table, this picture. So this is the initial period where you have common cold. So for first 5 days, this 4, 5 days, the symptoms are acute, they are troublesome. Then slowly the symptoms start reducing. Some of these cases may just linger on. If you see this, the persistent symptoms, some of the symptoms like slight throat irritation, slight cough, slight runny nose, continues for more than 10 days. So when it continues for more than 10 days, then we need to take it seriously. Suppose your symptoms are not getting better, or they were getting better, and then suddenly you again started falling sick. So this means that your symptoms have come back again. So this is the time when initially the disease is mostly by virus, but once your symptoms are improving and again you start feeling sick, so that means now the bacteria have taken over the problem. So then you need, again, in these conditions, then you need to treat it and take it sleep. Especially when you continue to have fever or you have a pain somewhere on the face which is localized to a particular sinus. So then you have to be, then you have to visit a doctor. So these are some of this slide shows some of the things which can predispose to sinusitis. Patients may have deviated septum, that is the part of the nose which divides the nose into right and left, may not be totally in the center, but it may be towards one side, causing blockage of the sinuses. Anything which causes the blockage of the drainage pathway, could be polyps, could be tumor, could be foreign body, could be a previous attack, inflammation, which has led to edema, or sometimes we ourselves, like patients come to us, they are sick, they are not able to eat. So we put tubes through the nose. So they also predispose to the sinus infections. And all patients may have their immunity may not be very strong. So they may have like diabetes patients, their body immunity is weak, or patients who are on chemotherapy, like medication for cancer treatment, or those who have undergone liver transplant, where the immunity is purposely kept low so that there's no rejection of the surgery that they've undergone. So these are some of the things. And some patients, like I told you about the cilia, the small hair, which keep beating and push the mucus backward. Some genetically, some patients may not have those cilia working properly. They may be deficient or they may not be working properly. So all these things can predispose one to the sinus infection. Most important thing to know whether you have simple cold or you have allergies or you have sinusitis. So one thing is history. So you should know, like if you have a patient who says that he's been sick for 2 days, fever and runny nose. So that means the patient is still in the first initial phase of his or her illness. And we give time, we just give time for them to heal on their own. It's better not to give too many medications in the initial phase so that the body immunity fights for the disease itself. Then we have other things which help us in diagnosis. I'll talk about them one by one. Once from the history, we have, like, we think that this patient has sinusitis. It's basically a clinical diagnosis. Like you tell us, the patients tell us that this and this, they have this problem. So we presume that, yes, they have sinus infection. Then to confirm whether they have sinus infection, we have endoscopes. Endoscopes are small tubes with light fitted on it, like a small fine torch going into the nose where you can see also the different depths of the nose. And then you see that you may see pus discharge, you may see polyps. So then you know that this patient may have sinus disease. Then in certain cases where you want to know, you are not sure whether they have sinus, we may also ask for getting a CT scan done. But CT scan is not done upfront in all cases. Suppose I have cold and I get a CT scan done. My CT scan will show all sinuses filled up with secretion. So that doesn't lead me to anything. Uh, anyway, I'll be taking the same treatment which I would have taken without getting a CT scan. So we avoid doing a CT scan in initial phase when the patient is still unwell. If we have to do a CT, we do once the patient is in a recovery phase. And that too, not in all cases. In cases where we are not sure of our diagnosis, or patients who keep getting cold very often, like recurrent, every 3-4 months they have this sinus issues. But that too, we don't do it in an acute phase. We let the acute phase subside and then ask them to get a CT once they feel better, so that we know what remains behind after the treatment has been given, and then we know what next to be done. Or sometimes we want to know what is the anatomy, what is the structural defect in the nose which may be leading on to the sinus problem.
Mm-hmm.
Then we have other tests to rule out other, like allergy tests to know whether they have allergies or not. Blood test also helps us to know various markers of allergy, or to know whether the infection is there in the blood or not. And there are certain sinusitis where by just examining, we are not 100% sure that what kind of, whether it's bacterial or it's a fungal sinusitis. So we take a small tissue and send it to our pathology colleagues. So they see it under the
Mm.
microscope and tell us whether fungus is present or not, and bacteria is present, what is the bacteria and to what antibiotic they are susceptible to. That in cases where they are not initially responding to our first line therapy.
Okay.
So coming to the management. So in this, I would say that don't jump to start taking antibiotics in cases of simple cold, simple flu, viral illnesses. Antibiotic is absolutely no. There are various reasons for it. One, if you see this small picture of mine, that if this is the number of cases who have common colds, this much cases continue to have some post-viral symptoms, which may last for another 10 days or so. And out of these many patients, small circle may have bacterial sinusitis, and out of that also a small dot of patients will require antibiotics. Why we don't give antibiotics in all cases? One, that antibiotics have their own side effects. Two, that these bacteria are very smart. So they keep changing their strategy to the different antibiotics. Suppose they know that this antibiotic is going to kill me this way. So they change their structure and then they become resistant to antibiotics. And
Yes.
so we are not left with any antibiotics. So patients, it's very difficult to treat. And that also patients sometimes will take antibiotic for just 2-3 days, and then again that same the problem is not solved. So best thing is all nani dadi nuskas that you can try initially. Take adequate amount of water, keep yourself hydrated, drink hot liquids are good. They try help in breaking up the mucus and allow the mucus to come out. Then this saline irrigation like Jal Neti, that is very, very helpful. You take saline and bring it to the body temperature and wash your nose with this. The all mucus will be washed out. So it's very, very relieving, and symptomatic improvement is there. Once the mucus comes out, the nose feels free and the congestion also becomes less. For
Yes.
fever, if then symptomatic means if you have fever, then you take treatment for fever. If you have nasal blockage, you use certain drops to open up your nose. But again, stressing here again that some nasal drops, they are habit forming. So never use them without doctor's prescription for more than 4 to 5 days. So if you continue using thinking that it helps in opening up the nose, sometime later it may be like it may harm you more than it gives you benefit. Coming to the medical treatment. So what are the cases which we say that yes, antibiotic is required? As I said, that if the symptoms continue to bother beyond 10-15 days, or fever is there, or headache is there, and the symptoms are really bad, patient is not able to continue with his routine work. So in these cases, we prescribe antibiotics. Sometimes when patients come to us, we tell them that, okay, that this is the treatment that you take as a symptomatic treatment, but suppose in 5-7 days you don't get better, then you start this antibiotic. Don't upfront start the antibiotic. And once you start the antibiotic, you have to take it for a long time. Don't take for 3-5 days, then it is going to
Mhm.
come back again. So in
Yes.
sinuses, if you've seen the diagram that I showed you initially, it's just a sinus, like air-filled cavities lined by
Mm.
the mucosa only on the periphery. So whatever medication has to come to that is from
Mm.
a very limited area. It is not going to go everywhere into the sinuses. So we need a lot of antibiotic to reach there to have its effect. So that is why we stress that once you are symptom free, beyond that you take for at least 5 to 7 days so that this disease doesn't come back again. For acute viral, it's okay if you take 3 days, you feel better. You think that antibiotic has worked, but it's not the antibiotic which has worked. It's the self-limiting disease, and it has become all right on its own. And we think that oh, antibiotic has done wonders. So when you another thing about diseases which are chronic, like when this problem continues for long, we sometimes even give steroids. So steroids, when somebody listens that, oh, this is steroid, so they get scared. Under doctor's prescription, if it is given by a doctor, and you are under regular follow-up with the doctor, given steroids given for some time are helpful in this case, because this is inflammation. This is not all infection. There's a difference between infection and inflammation. Inflammation is a certain way the lining of the nose behaves. It becomes totally inflamed, and sometimes you have to give steroids for it to come back to its normal structure. And it's a steroid which is given in the nose, which doesn't even go to the blood, or very minimal amount goes into the blood, but it is very helpful in certain cases of chronic sinusitis and certain cases of even acute sinusitis, but under uh, guidance of a doctor. Then other things I've written, various other things.
Okay.
These are just like basically building up your body immunity and symptomatic treatment. Mucolytics helps in bringing out the mucus. Then you should have your flu vaccine. Those who, like elderly patients who are prone to flu, because it is basically flu which will again progress to bacterial sinusitis. So you need to have some preventive measures also. Now, coming to surgery, sometimes in these cases of sinusitis, we have to operate. These are the cases who do not show good response to medical therapy, or who keep having these recurrent attacks of rhinosinusitis, or we feel that there is an impending complication which may happen if we do not operate, or they have some structural defect which is blocking their sinuses and leading them to have repeated episodes, or some cases of polyps, which causes permanent, continuous nasal blockage and stuffiness and reduces the quality of life. So, basically, when we are doing surgery, we do it under general anesthesia, or in case if it is very limited disease, then we may do it under. So, basically, after clearing the disease, the patients can go home either same day or next day, and we call them for follow-up for taking out the dressings, or post-op cleaning. In some cases, post-op follow-up is very important, especially initial days. And in some cases, it's a combination of surgical as well as medical therapy which works, especially in nasal polyposis or certain kinds of fungal rhinosinusitis, where we cannot say that we've done surgery, now the disease is clear. And like in some surgeries, once the surgery is done, patients feel that now their job is over. They need not go back to the doctor. There are certain diseases, certain problems in sinusitis where a combination of therapy is required. Basically, when we are doing surgery, what we are aiming at, we do a functional endoscopic sinus surgery where the instrument is the endoscope, and we take care of the functional aspect, that is the normal mucosa, which helps in cleansing the nose and the sinuses, that is not disturbed. So we only remove the diseased mucosa, or we remove the disease itself, that is if there's secretions or pus or polyp that are removed, so that they no longer block the drainage pathway of the sinuses. So basic aim is clearance of the sinuses, providing good drainage to the sinuses. And once the sinuses are open, they are well ventilated, so chances of bacterial infections are less, and it gives better quality of life to these patients without headaches and without nasal blockages. And if your nose is fine, then you don't have increased risk of getting chest infections or chest allergies. When we are treating sinusitis, we must have some other diseases in mind which can present in a similar way. Like allergies, some patients think that they have sinus. Allergies can predispose one to sinuses, but allergy rhinitis is simply a disease limited to the nose mucosa, where they have itchiness of the nose, frequent sneezing. The moment they get up in the morning, they start sneezing, or if they're exposed to dust, or strong smells, or sudden change of temperature. So these are the states when they start having more of a runny nose or a itchy nose, and they do well with antihistaminics. And in some cases, we have to give them steroid sprays also, which help in reducing the inflammation. And we have to differentiate the sinusitis from acute flu or rhinitis. Then another condition, which is rhinitis medicamentosa. Medicamentosa means caused by the medicine itself. If you continue using nasal decongestant drops for a long time, they cause rebound congestion, or the person becomes dependent on that, that if they don't put drops in the nose, they are not able to breathe. So these are the patients, they must visit doctors. Simple sprays of other kind or simple procedures can make their life much better. Then some patients may have a runny nose when they are stressed or when they're eating. So this is altogether a different topic, and then treatment is also different. And the sinus disease may be confused with dental problem, or migraine also presents with headache, and sinus also inflammation also presents with headache. And we must differentiate the migraine headache from sinus headache. Usually migraine headache is triggered by, say, stress, or by late evening once the person is tired, or going out in the sun, or they've not had food properly, or sudden triggers are there. And it becomes better when you rest or when you sleep. When you get up, you feel better. Other way around, the sinus headaches becomes worse when you lie down because of the gravity. The secretions are not able to drain properly, and they all cause increase in the congestion, so more headache. Then there are certain systemic problems, or patients who have immunocompromised, so they have invasive fungal disease. This also a doctor keeps in mind while treating this. As the sinuses are very close to the orbit and brain, so infection can spread to these areas. If you have any vision change, pain in the eyes, or headache which is persisting, or the fever which is not coming down, you must seek doctor's help. Then regarding prevention, eat healthy, take your flu shots, protect yourself from smoke and pollution, maintain hand hygiene. This we have all learned in COVID. Wear mask if you have
Yes.
a flu, and take proper medication for optimum duration and under doctor's guidance. And this is already covered when to see a doctor. So now, if you have any questions, I'm there to answer them.
Thank you so much, ma'am, for this wonderful explanation. Ma'am, I do have some questions.
Yeah.
Ma'am, how many types are there of sinusitis?
See, if you can divide them into different types, depending on first duration. Suppose you say that time duration, then I said acute, subacute, chronic, depending whether it's less than 4 weeks, between 4 and 12 weeks, more than 12 weeks. Then we also divide them whether this is because of primarily the nose problem, that is, the nose and sinuses itself are causing the issue, or it is secondary to some problem in the body, like if they have any genetic problem, or any inflammation which is of systemic origin, or because of some immunocompromised status. So this is called secondary to something else in the body. Then also depending on the pathology, like what is the body's reaction to whatever is causing the sinusitis, type 2 reaction or type 1. So depend. This is for doctors only. Like it helps us to treat it better. But from a general perspective, I think depending on the duration is good enough for you people to know. So if suppose in 5-7 days your nose is not getting better, or maybe at 10 days, so you seek a help from the doctor. Or if it is lingered on, then you need to take a certain kind of treatment. And if it is lingered beyond 3 months, the symptoms may become less acute, but still they may have impact on your health. So duration is good enough for you people to decide when to visit a doctor.
Yes, ma'am, sure. Ma'am, how can anyone avoid sinus?
Uh, One thing is that if you have cold, first thing is when you get cold, suppose you have chill drinks, cold drinks, unhealthy stuff, and the sudden change of temperature. So all these things, or cold weather, all these things make you more prone to flu. And if flu doesn't get better in time, then this may go and progress on to become a bacterial infection. So at the level of the
Okay.
flu, treat yourself, keep yourself well hydrated, drink lots of fluids, avoid spreading infection to others, cover your nose and mouth when you cough, when you sneeze, or other persons who have cold and coughs, you stay away from them. Build up your body immunity. You should be strong enough to fight the virus and the bacteria only if you eat well, and those who are more prone to infection should get before winter should get flu shots. um, these are the basic things that you should keep in mind.
Okay, ma'am. Ma'am, what is chronic sinusitis and how it is cured?
Chronic sinusitis is one which has stayed with you for more than 4 weeks. So
Okay.
initially, it depends on the symptoms. What are the symptoms? What are the different types of chronic sinusitis? One, it could be because of bacterial inflammation, because of the bacteria, and other it could be because of polyps. So we divide it into without polyp and with polyps. So with polyps, initially we give steroid sprays and sometimes a short course of systemic steroids also, which help in these patients. And if the response is good, then they continue to have this minimum dose which keeps them symptom free, or as and when there is a exacerbation. But if they do not respond, then sometimes we have to do surgery in these cases. Then certain polyps are because of aspirin sensitivity. That patients who take aspirin, every time they take aspirin, they get this breathing difficulty. So that's a
Ah,
different treatment for this, because in these cases, they respond to steroids to some extent. Surgery, if we do in these cases, they tend to come back. Sometimes we even have to desensitize them to aspirin. Then there could be fungal polyps, which is again a different kind of a polyp. So if you have polyps or if you have chronic sinusitis, you must visit a doctor, because it's not just one disease. It's a spectrum of disease or diseases, and all may have different presentation and different treatments.
yes, sure, ma'am, true. Ma'am, what to do if someone's throat is scratchy?
Again, there may be different reasons if throat is scratchy. One, it could be allergy, simple allergy. Then anti-allergics,
Yes.
they work in these cases. Or patient may be having post-nasal drip, that is the this thing from the nose is trickling backwards and causing irritation of the throat. Some patients may have reflux, that acid in the stomach, that they have too much of acidity, and when acid comes up all the way to the throat, again it causes irritation in the throat. So it can be affected by different ways. uh, Best thing for you people is to drink lots of water in these cases. And if it doesn't respond to your gharelu totkas, then you visit a doctor to find out what is the cause of it.
Yes, ma'am, sure. Ma'am, if someone is having trouble in breathing, so what to do in that case?
Trouble in breathing depends which level the breathing problem is there. It could be at the level of the nose, it could be at the level of nasopharynx, that is behind the nose, throat, and lower down. Usually, a patient is able to know whether it's the nose which is blocked or it is at the level of the neck. I'll restrict myself to the nose. In children, we see that many children, they do mouth breathing, that they are not able to breathe through the nose, and they snore also. Most of these patients, they snore also. especially in children, if you see, the adenoids is a big problem in children. And by the age of 6 years, they should be able to breathe properly through the nose. Otherwise, their dentition starts getting affected. You must have seen children with protruded teeth, and they can't even close their mouth properly later on. And this is
Yes.
the thing which needs to be taken care of. Or you may have congestion in the nose, which could be because of acute problem. You can take steam inhalation. You can use nasal drops for a few days, like 4 to 5 days. The ones that I mentioned, that they can cause uh, rebound congestion. So for 4 or 5 days during acute phase, you can use nasal drops. You can use saline irrigation, or you can take steam inhalation if stuffiness is bothering you. But if you don't feel better, then again go to the doctor.
Yes. Ma'am, can sinus disease can affect someone's health like in other way?
Sure,
Nose
it
is
can.
affected, but
Yes, yes. See, you must have seen after cold, or when you have cold, if you fly, your ears get blocked. Or when you blow your nose too hard, suddenly you start feeling that as if you can't hear properly from the ears. So
yes.
ears are can get affected, and there may be hearing loss. Patients, especially in small children, they keep getting cold. Parents don't think it's a simple cold, but then they start showing poor performance in the school. And when we test, we see that they cannot hear properly. It can affect the hearing. That needs to be managed. And then there's a tube which connects back of the nose to the ear. So that is from where the infection goes. Then it can affect some serious diseases, or a very acute problems can go to the eyes and the brain, but that is complicated, like one of the complications. Then throat, again, the patients may start having this itchiness in the throat, or may have constant irritation in the throat, or they keep coughing. They need to clear their throat quite often. It disturbs the sleep if you don't have proper breathing from the nose and you are not able to
Huh.
sleep. It affects your performance in all ways. So it does affect you feel fatigued all the time. You don't feel like working. And this nose problem, if you have persistent postnasal drip, then your chest also gets affected. Many patients of allergies of the nose, they get asthma. If you treat nose properly, then the chances of developing asthma are also less. It's a same, actually, the airway is in continuity. So problem in one area can affect the other area as well.
Okay, absolutely, ma'am. Thank you, ma'am. Thank you so much for this wonderful, comprehensive, and detailed presentation on topic nose and sinus.
My
I
pleasure.
once again thank you, ma'am, for your
Thank you.
time. Thank you, ma'am, for being with
Thank you.
us in our health talk session.
My pleasure. Thank you.
Thank you, ma'am.